Mood disorders are a category of mental health conditions that primarily affect a person's emotional state. They involve periods of extreme or prolonged disturbances in mood, which can significantly impact daily life. These disorders can range from severe sadness and hopelessness to extreme elation and irritability. Mood disorder types. Major depressive disorder, or MDD, is characterized by persistent and intense feelings of sadness and hopelessness. Symptoms include changes in sleep, appetite, energy levels, concentration, daily behavior, and self-esteem. It can also lead to thoughts of death or suicide. Persistent depressive disorder, also known as dysthymia, is a chronic form of depression lasting for at least 2 years. Symptoms are less severe than MDD but more enduring, such as low energy, poor self-esteem, and difficulty concentrating. Bipolar disorder involves episodes of depression alternating with episodes of mania or hypomania. Bipolar I includes severe manic episodes, while bipolar II features hypomanic episodes and depressive episodes. Cyclothymic disorder is a milder form with fluctuating hypomanic and depressive symptoms. Seasonal affective disorder. Seasonal affective disorder, or SAD, occurs at specific times of the year, usually in winter when there's less natural sunlight. Symptoms include fatigue, increased sleep, weight gain, and cravings for carbohydrates. Premenstrual dysphoric disorder is a severe form of PMS, with symptoms like severe irritability, depression, and anxiety in the week or two before menstruation. These symptoms typically subside after the onset of menstruation. Symptoms of mood disorders. Persistent sans or low mood. Feeling down, sad, or hopeless most of the time. A sense of emptiness or despair. Loss of interest or pleasure, anhedonia. Inability to feel pleasure from activities or relationships. Reduced interest in activities that were once enjoyed. Changes in appetite or weight. Significant weight loss or gain not related to dieting. Decreased or increased appetite. Sleep disturbances. Insomnia, difficulty falling or staying asleep, or hypersomnia, excessive sleeping. Changes in sleep patterns, such as waking up early and being unable to fall back asleep. Fatigue or loss of energy. Persistent feelings of tiredness or exhaustion. Lack of motivation and difficulty performing daily tasks. Feelings of worthlessness or excessive guilt. Harsh self-criticism and feelings of guilt about past actions or events. Low self-esteem and feelings of being a burden to others. Difficulty concentrating or making decisions. Trouble focusing on tasks, remembering details, or making decisions. A sense of being overwhelmed by even simple tasks. Psychomotor agitation or retardation, physical symptoms such as restlessness, fidgeting, or pacing, agitation, slowed movements, speech, or thought processes, retardation. Irritability or anger, easily frustrated or angered, often without clear reason. Frequent conflicts with others. Recurrent thoughts of death or suicide, persistent thoughts about death, dying, or suicide. Suicide attempts or plans. Impact on daily life. These symptoms can severely impact various aspects of a person's life, including personal relationships, strain on relationships with family, friends, and coworkers due to irritability, withdrawal, or conflict. Work or school performance, difficulty concentrating, making decisions, and maintaining productivity or attendance. Physical health, changes in sleep and appetite can affect overall physical health and energy levels. Daily activities, loss of interest and motivation can lead to neglect of personal hygiene, household responsibilities, and social activities. Causes of mood disorders. Genetics, mood disorders often run in families, suggesting a genetic predisposition. Biological factors, imbalances in brain chemicals, neurotransmitters, such as serotonin, norepinephrine, and dopamine. Environmental factors, stressful life events, trauma, and significant life changes. Psychological factors, negative thinking patterns, low self-esteem, and poor coping skills. Medical conditions, chronic illnesses, hormonal imbalances, and certain medications. Treatment approaches. Medications like antidepressants, mood stabilizers, and antipsychotics can help manage symptoms. It's important to work with a healthcare provider to find the right medication. Psychotherapy. Cognitive behavioral therapy, CBT, helps individuals identify and change negative thought patterns and behaviors. Dialectical behavior therapy, DBT, combines CBT with mindfulness techniques. Interpersonal therapy, IPT, focuses on improving relationships and communication. Psychodynamic therapy explores unconscious processes and past experiences. Lifestyle modifications. Regular physical activity. Healthy diet. Adequate sleep. Stress management techniques such as mindfulness and meditation. Advanced treatments. Electroconvulsive therapy, ECT, used for severe depression that does not respond to other treatments. Light therapy, particularly effective for SAD. Transcranial magnetic stimulation, TMS, non-invasive method using magnetic fields to stimulate nerve cells in the brain. Support systems. Support groups, family and friends involvement. Regular follow-up with healthcare providers. Conclusion. Mood disorders can be challenging, but with the right treatment and support, recovery is possible. Understanding the different types, recognizing the symptoms, and seeking appropriate treatment can help individuals manage their mood disorders effectively and lead fulfilling lives. If you or someone you know is struggling, reach out for help. Don't forget to like, share, and subscribe for more information on mental health and wellness.